Hello and welcome to our provider training on the Health First Colorado Doula benefit. The goal of this training is to support doulas in enrolling in Health First Colorado, the state's Medicaid program, and to bill for services. This training is sponsored by the Colorado Department of Healthcare Policy and Financing, or HCPF, sometimes referred to the department in this presentation. A doula is a trained professional who provides continuous physical, emotional, and informational support to their client before, during, and shortly after childbirth to help them achieve the healthiest, most satisfying experience possible. Examples of this support includes providing information about what to expect at different stages of pregnancy and postpartum, suggesting relaxation or breathing techniques to manage pain during labor, improving the focus on patient-centered care, and offering culturally appropriate birth practices. This support is shown to improve health outcomes and advance health equity. Let's start with an overview of the benefit. Health First Colorado's doula benefit covers 3 important services: prenatal care, labor and delivery, and postpartum care. A doula can be reimbursed for up to 180 minutes of prenatal care per member at $25 per 15 minutes of service. There is a cap of 12 units or $300 per member during a 12-month period. The period starts at the time of the first doula claim. A doula can also be reimbursed for supporting the member during labor and delivery. The reimbursement structure for postpartum care is the same as that of prenatal care. The doula benefit is meant to offer doulas and their clients flexibility so services can best meet member needs. For example, one member may prefer to use benefits equally in the prenatal and postpartum period. Another may want more frequent, shorter visits during the postpartum period. Finally, a member may start accessing services after delivery and just receive postpartum doula care. Some important considerations. Both prenatal care and postpartum care have individual caps, so a member cannot forfeit prenatal care for more postpartum care beyond the $300 postpartum cap. All benefits relate to the member. If more than one doula supports the member, then the combined time across those doulas cannot exceed the caps. The reimbursement per delivery is $900, regardless of how long labor and delivery lasts. The doula and member should discuss expectations and processes should the delivery and labor exceed the time that the doula is able to assist. Doulas can provide prenatal and postpartum care in the member's home, in any other community-based setting, such as an office, or via telehealth. Labor and delivery services cannot be provided via telehealth. While doulas must provide in-person labor and delivery support, the location of that support can vary. Individuals and organizations interested in providing doula services to Health First Colorado members must first prepare their business for enrollment. Then, doulas must determine how they will meet qualifying requirements. The department does not require a specific doula certification. Instead, doulas can select a pathway, certification, or experience and gather documentation and attestations demonstrating they meet requirements associated with their selected pathway. Doulas then enroll through Medicaid Provider Web Portal. Once the enrollment is complete, doulas provide and bill for services. Doulas must revalidate through the Medicaid Provider Web Portal every 5 years to demonstrate ongoing compliance with the pathway and other requirements. Before we go into each of these steps in more detail, we want to present the list of required documents you'll need to upload to the Medicaid Provider Web Portal or to keep in your records. As you can see by the table, the documents depend on the enrollment pathway you select. All doulas need administrative documents, including copies of a driver's license or state ID, an insurance policy, a voided check, and a W-9 with a Social Security number. Doulas also need common forms that demonstrate they meet qualifying criteria. The final set of documents depend on the pathway. Those who pursue the certification pathway need a doula certification. Those who pursue the experience pathway need letters of recommendation. It is critically important to use your legal name across all these documents. This name should appear on your driver's license, W-9, training certification, liability insurance, and fingerprinting card. If your name is not consistent across all these documents, your application could be rejected. We'll describe each of these documents later in the training. Please note that while you do not have to upload information about the results of your background check into the Medicaid Provider Web Portal, you will need to complete a background check as part of the application process. This training will discuss each step in more detail. First, it can help you prepare for Health First Colorado Enrollment. You may choose to register as a business with the Colorado Secretary of State and will need to obtain identifiers required for enrollment. We'll also discuss sound business practices so you can provide person-centered care, maintain client confidentiality, and meet federal and state requirements. Then we'll review general requirements and those specific to each pathway. The next section walks you through how to register for the Medicaid Provider Web Portal and submit an application. In order to process your application as efficiently as possible, you'll want to gather your documentation prior to starting your application on the Medicaid Provider Web Portal. We'll discuss the billing processes. And finally, provider maintenance and revalidation. Now we'll talk about preparing your business for Health First Colorado enrollment. Doulas must enroll in the Health First Colorado program to bill for services provided to members. To do so, some doulas may want to start a business. Other doulas may already be operating within a group already enrolled in Health First Colorado. When preparing your business for enrollment into Health First Colorado, there are several steps to consider. You may want to establish a business name that is consistent across all your legal forms and enrollment documentation. You will also need to register with the Colorado Secretary of State and apply for a National Provider Identifier, or NPI. There may be administrative costs associated with starting a business in Colorado, such as paying the Colorado Secretary of State's filing fee. We dive deeper into each of these steps in the forthcoming slides. The steps you need to take depend on how you operate. Sole proprietor doulas may want to register as a business and will need an NPI to enroll. Each doula within an existing doula group or healthcare group will need an NPI and will submit an individual application. Note that these groups need to already be enrolled in Health First Colorado. Establishing a business name and using it consistently throughout the enrollment process is crucial. Your business name must be the same on your application submitted through the Medicaid Provider Web Portal, your attestation forms, your Internal Revenue Service forms, and your registration for an NPI. Any slight mismatch means your application will not be approved. If you choose to use a Doing Business As, or DBA, which is separate from your business name, it also must be consistent across the enrollment process. If you decide to register as a business, you will apply through the Colorado Secretary of State Business Organizations website. The agency offers a Starting a Business in Colorado e-learning module that walks you through your legal structure, creating a business name, and filling out the correct forms. Be sure to save your login credentials so you can access your account later. It is also important to save the business registration document and certificate of good standing. However, you can access these documents anytime on the Colorado Secretary of State website. You will need your business structure or organization type to enter into the Medicaid Provider Web Portal. When registering your business, be sure to follow the instructions clearly, including adding an abbreviation of the name depending on the type of business you choose, such as LLC. If you have questions, you can contact the Colorado Secretary of State using the contact information displayed on the screen. Doulas need an NPI, a unique 10-digit identification number for covered healthcare providers, obtained from the National Plan and Provider Enumeration System, or NPES. The NPES assigns NPIs. You can apply online. NPIs are needed for billing, eligibility and enrollment, and referrals and authorizations. Individual practitioners, organizations, and individuals a part of a group can all have an NPI. Individual practitioners and individuals a part of a group need their own NPI if they perform standard transactions on their own, separately from their parent organization. A doula group may have a Type 2 NPI. Sole proprietors and individuals within a group need their own NPI, a Type 1 NPI, for Health First Colorado enrollment and billing purposes. Part of the information you need to apply for an NPI is your taxonomy code. The Provider Taxonomy Code specifies the services you provide. The Doula Taxonomy Code is displayed on the screen. You must also enter this taxonomy code into the Medicaid Provider Web Portal. At least one of the taxonomy codes in your Health First Colorado application must match the codes you used when applying for the NPI. If not, your Health First Colorado application will be rejected. The NPES registry lookup can be used to see the taxonomy codes currently associated with any NPI. You can always add a taxonomy code through NPES to ensure that it matches the one in the Medicaid Provider Web Portal. If you have any questions about obtaining an NPI, you can contact NPES using the contact information displayed on the screen. Doulas enrolled in Health First Colorado must also establish sound business practices that allow them to provide person-centered and responsive client care while maintaining client confidentiality. There is a lot you can do to manage successful businesses. Today, we'll touch on just a couple of these. Many relate to being good stewards of Medicaid funding, which comes from taxpayer dollars and has obligations. Make sure you understand your responsibilities as they relate to service compliance, accurate billing, and being prepared for audits. First, you'll want to create a standard client intake process. Intake forms can capture client, contact, and demographic information and information to help you provide comprehensive care that is responsive to the client's birth desires, including health information and support needs, and birth preferences. We'll talk about securing client information later in the presentation. Part of your intake process should be to verify client enrollment into Health First Colorado. Once you've enrolled as a provider, you will need to have access to member eligibility in the Medicaid Provider Web Portal. Take the following steps to verify Medicaid eligibility. Request insurance information during client intake, including Medicaid ID. Log into the Provider Medicaid Web Portal. Click on the Eligibility tab. Enter client details and click Submit. If you do not have the member's Medicaid ID, then enter two of the following: Social Security number, date of birth, or name. If the client is not enrolled in Health First Colorado, support enrollment by pointing the client to the Colorado Peak system. Clients can also contact their County Department of Health and Human Services, which will have trained enrollment specialists. Individuals can also apply over the phone at the number shown on the screen. Finally, to be eligible for doula services, members need to be recommended by a clinical provider, such as an OBGYN, midwife, or therapist. This will promote better coordination across the client's providers, especially during labor and delivery. Clients can obtain a recommendation form from their provider and give it to you. Keep this form in your records for auditing purposes and document the NPI for later submission. You must enter the provider's NPI in your claim for payment. You should also develop and maintain a records management system that allows you to securely collect and store information about your clients and services. These systems are crucial for effective care provision as they enable doulas to track the specific needs of each client and thus support families in their personal preferences. Well-maintained records can also facilitate efficient communication between you, your clients, and other providers. In addition, a secure records management system can help you maintain client confidentiality and thus comply with state and federal regulations. Finally, if you are audited by Medicaid, you will be required to pull a sample of Health First Colorado members. Your records management system should allow you to quickly identify and share those records. Out-of-date records can delay the audit process and potentially lead to financial penalties. Some examples of key information to store in a record to promote a successful audit are member name, member Medicaid ID, all visits including dates, length, services provided, and mode, and essential client information. Doulas may choose to manage their records through paper charts or by developing and purchasing an electronic data management system. They may also rely on a combination of both. For example, clients may fill out intake forms via paper and then transfer that information into an electronic system. Regardless, ensure you are following federal and state requirements related to data security. Paper records should be stored securely and locked. Electronic data management systems should require login credentials and have appropriate firewalls to protect personal health information, or PHI. Client communication and information sharing should also follow the highest security standards. For example, do not email client information unencrypted. Next, we'll talk about meeting Health First Colorado doula requirements. There are two pathways for doulas to satisfy requirements to become enrolled: the certification pathway and the experience pathway. The certification pathway is for doulas who completed formal training with a department-approved doula training organization. The experience pathway does not require formal training, but does have a higher requirement for birth attendance. All individuals must meet pathway requirements, including all individuals within a group practice who want to bill for services. The certification and experience pathway each have their own documentation requirements. Some documents, such as CPR certification, are required by both pathways. Some requirements, like a letter of recommendation from a clinical provider, is just required for the experience pathway. A list of documentation requirements for each pathway is displayed on the screen. I'd like to remind you again to use your legal name on all of these documents to expedite approval. The certification pathway requires 4 signed attestations to be submitted, which we'll go over in more detail. First, I attest that I have received training as a doula from one of HCPF-approved training organizations. You will need to complete at least 18 hours of training, and you will attach a copy of your certification of training completion with your application in the Medicaid Provider Web Portal. In order to become Colorado State Certified Doula or a community birthing partner to serve Colorado members and be reimbursed for these services, training entities must complete the application requirements to be considered for the approval process. They must indicate the number of hours that correspond to each competency and attach a syllabus. Second, I attest that I have attended at least 3 births within the last 5 years. Your own experience giving birth does not count for births attended. You will complete the birth attendance attestation form stating that you meet this requirement. Third, I attest that I have current CPR training credentials. Different training programs may have different durations. Make sure you've taken training recently enough to have active training credentials. Doulas are required to receive adult and infant CPR certification. You will upload a copy of your certifications with your application. Please note that there may be costs associated with becoming CPR certified. For 2025, we found they ranged from approximately $30 to $150 in Colorado. Finally, I attest to follow the Doula Code of Conduct. Review the code, sign it, and submit the signed copy. The Doula Code of Conduct, which highlights your commitment to culturally competent and respectful care, professional conduct, client privacy, and continuing education, can be found on the HCPF website in English and Spanish. The experience pathway shares 3 attestations with the certification pathway. The experience pathway differs from the certification pathway in that it does not require any specific training other than CPR certification and lived experiences. Note that the birth attendance attestation requires the same paperwork but has different requirements, which we will go over now. 2 attestations are exactly the same as the certification pathway. I attest that I have current CPR training credentials, and I attest to follow the Doula Code of Conduct. The experience pathway requires more lived experience in births than the certification pathway. For the experience pathway, you must attest that I have attended at least 10 births in my role as a doula and at least 5 births in the last 2 years. As already mentioned, the birth of your children do not count toward births attended. You will complete the birth attendance attestation form stating that you meet this requirement. In addition, I attest that I have attached 4 letters of recommendation. You will submit a total of 4 letters of recommendation with your application. Of the 4 letters, 1 must be from a clinician who is the primary obstetric provider at a birth you attended. 2 must be from previous clients that you've worked with as a doula. The last letter of recommendation should be from a colleague or doula. Finally, you will need to submit an attestation that you have knowledge and competency in the following areas: prenatal, labor and delivery, and postpartum care. Initial beside each of these competencies and submit your form with your application. Some of the competencies related to these domains are displayed on the screen. For example, doulas should have a good understanding of childbirth education in the prenatal period, labor support techniques during labor and delivery, and feeding and lactation support during the postpartum period. Attestations should be filled out by each doula, signed, and uploaded to the Medicaid Provider Web Portal. The Doula Provider Attestation form is displayed on the screen. These forms can also be found on the HCPF website in English and Spanish. The Letter of Recommendation form can also be found on the HCPF website in English and Spanish. Doula care is a high-risk service, meaning you'll have to go through a background check. Make an appointment with IdentiGo and use the code displayed on the screen. The department will then check to ensure that all owners listed in your application have received and completed the background check. Doulas are also required to have insurance. It can be professional insurance or insurance through your doula group, such as liability insurance. There also may be a cost associated with this insurance policy. Doulas are not mandatory reporters, but doulas may still take the Colorado Department of Human Services free mandatory reporting training if they want to. While doulas are not mandatory reporters, this training may empower providers to recognize the signs and symptoms of abuse and instill confidence in their ability to take appropriate action should they suspect abuse. Next, we'll talk about enrolling through the Medicaid Provider Web Portal. The first step to enrollment is to make sure you have everything you need to register through the Medicaid Provider Web application. Providers must be registered and in good standing with the Colorado Secretary of State. Have this certificate available. You will need your taxonomy code and NPI number. You will also need the address where services are provided, an avoided check or bank letter, and a completed IRS Form W-9 to ensure payment. Make sure you have other documents to upload, including a copy of your driver's license, insurance policy, attestations, Doula Code of Conduct, and information corresponding to your selected pathway. Once again, use your legal name on all documents when filling out the fields in the system. To begin enrollment, access the enrollment application through the Medicaid Provider Web Portal, then read the accompanying message and hit Continue. On the next page, you'll first select your enrollment type. There are 3 types that relate to doulas: group, billing individual, and individual within a group. Doulas should select billing individual if they are a sole proprietor, or individual within a group if they are part of a healthcare or doula group. Unless you are already a part of a group, you should select billing individual. Note that the group must be enrolled in the Medicaid program before you can apply as an individual within a group. Then select your provider type. If you are enrolling as a group, you'll select Code 72. If you are enrolling as a billing individual or an individual within a group, you'll select Code 79. The requesting enrollment effective date should be the date you submit your application. Then enter your NPI. When entering your zip code, use the 9-digit zip code associated with your NPI. You can find this zip code on the USPS website. Next, enter your taxonomy code. The Doula Taxonomy Code is displayed on the screen. The tax ID should be your Social Security number if you're enrolling as an individual, or an EIN if you are enrolling as a group. The requesting enrollment effective date should be the date you submit your application. Finally, you'll enter your contact information. Make sure to enter your legal name as it appears on all the documentation you'll need to submit. After entering your contact information, you will create a password for your account and answer 3 security questions. This will allow you to pause and resume the application if you need to by clicking Finish later. You will also be provided with an application tracking number, which can be used to check your application status. Make sure to save your username, password, and tracking number somewhere safe so you can reference them later. When selecting a specialty, you should select Doula for specialty and taxonomy. Make today's date the specialty effective date and leave the end date blank. On the Following Addresses tab, add the address where you bill for services, provide services, and receive your mail. You will need to enter an address for each of these address types, but they can be the same address. Use the address you registered for your business with the Colorado Secretary of State. When entering the addresses, click Add at the bottom of the page to save the addresses. You'll receive an error if you click Submit before you add all 3 types of addresses. You must put an office phone. You will receive an error if you only provide a cell phone number. It is okay if your office number is the same as your cell phone number. On the next page, complete the provider identification information. Enter your legal provider name or doing business as name. Please note that your legal name should be different from your DBA name. If you do not have a DBA name, leave it blank. Even if you have a relevant degree, you should leave the degree, school, and year of graduation fields blank. Select your organization type. The organization type should be sole proprietor if you are a billing individual or individual within a group. If you are applying as an individual within a group, you will enter your group's Type 2 NPI and select the type, such as LLC or nonprofit. Select Title 19 payer. You should also skip the license section. It is not required. Fill out the certification fields if you are applying under the certification pathway. Enter doula as the specialty and other for the certification type. Input the effective start and end date of your certification or training certificate. If you don't have a certificate number, then enter 00000. Make sure to attach a copy of your certification or training certificate on the Supporting Documents field later in the application if you have one. When you are finished entering your information, click Add to save the information to your application. You do not need to fill out information on Medicare or Managed Care network participation. Add the languages you speak on the Languages page. Add languages only if you speak them fluently. You will need to select at least one language. On the EFT Enrollment tab, you can skip over the Other Identifier, Trading Partner ID, and Assigning Authorities boxes. You will need to fill out your bank information so that you can receive automatic payment. Your NPI and tax ID will be pre-populated at the top of this page. Check this information to ensure that it is accurate. Enter the information into the Financial Institutions screen at the bottom of the page to ensure payment. Make sure the information you enter matches the information in the voided check or bank letter you will need to upload later in the application. Please note that a direct deposit form is not an acceptable replacement for a voided check or bank letter. Skip through the addendums page, as no additional addendums are required for doulas. Read any disclosures that appear on the Disclosures page by clicking on the disclosure name, answering the accompanying questions, and then clicking Add for each disclosure. Make sure to only enter the NPI number, not the TIN number, on this screen. Enter your insurance information on the Other Information tab. This includes your carrier name, policy ID, insurance type, effective and expiration date. As a doula, you must have professional or liability insurance. Next, you will complete the Medicaid participation questions. Click on the link for each disclosure, complete the information, and click Add and then Submit. Groups must list owners' social security numbers, practice addresses, and date of birth. Once all are completed, click Continue. Complete the background check information on the next page. Fingerprinting background checks are required for doulas. You will need to pay to be fingerprinted. Be sure to use the code displayed on the screen when making an appointment with IdentiGo, the agency that conducts background checks. HCPF will then ensure that all the individuals listed on your application have received the background check. In 2025, the cost of fingerprinting was $16.50. Upload the supporting documents on the Attachments and Fees page. Your W-9 and voided check or bank letter should be filed as their specific attachment type. All other documents will be listed as Other. Read and agree to the Provider Enrollment Agreement on the Agreement tab. Be sure to print or save the agreement for your files or records. The Final Summary tab will give you a chance to review the information you provided. Click Submit once the information is correct and you're done. Please note that some providers of moderate to high-risk specialties undergo a virtual site visit with the fiscal agent to ensure that the provider is operating as a legitimate business. Let's move on to how you bill for services. Once you are registered in the Medicaid Provider Web Portal and begin to provide services, you will submit electronic claims directly through the portal to be reimbursed for services to the bank account you provided. The claim will include information on the services you provided and will be reimbursed on a fee-for-service basis, meaning that you get paid for whatever services you rendered. It is your responsibility to submit billing information. You will have up to 365 days from the start of the service to submit your claim. After 365 days from the date of service, a claim is no longer eligible to be paid. For prenatal and postpartum care, you will bill time in 15-minute increments up to the maximum of 180 minutes each. The number and length of visits is at your discretion. For example, 3 hour-long visits and 6 30-minute visits are both equivalent to 12 units. For attending a labor and delivery, you will bill 1 unit of service. Following information is required to submit a successful claim. First, your Medicaid Provider ID. You will be provided this number once you are enrolled in Health First Colorado. You will also need your Provider NPI number. You included this code as part of your Health First Colorado application. See the Preparing Your Business for Health First Colorado training for more information. You will also need the NPI number of the client's recommending provider. See the Establishing Good Processes for Doula Practices section for more information. Make sure you include your member Medicaid ID. This code is assigned to people who are covered by Medicaid. Note that clients enrolled in CHIP Plus are eligible for doula services. The Doula Billing Manual applies to both Health First Colorado and CHIP Plus enrollees. Include the member information such as their name, address, and date of birth. You will also need a diagnosis code. These diagnostic codes communicate the condition being treated. Report a diagnosis code of Z33.1 indicating a pregnant state for prenatal visits and labor and delivery. Report Z39.2 for routine postpartum follow-up for postpartum visits. Include the HCPCS code. These procedure codes communicate what services were delivered. Report a HCPCS code of T1032 indicating doula birth worker services for prenatal and postpartum visits. Report a HCPCS code of T1033 indicating doula birth worker services for labor and delivery. Units indicate the number of services represented in the claim. Report 1 unit for each 15 minutes of prenatal or postpartum visit. For example, an hour-long visit is 4 units of 15 minutes. Report 1 unit for labor and delivery. For labor and delivery services that occur on multiple dates, report only the first day of labor in the claim. After submission, you will receive immediate feedback on whether your claim is accepted directly into the Medicaid Provider Web Portal. A paid status indicates that the claim is complete, does not require additional review, and no further action is necessary on your part. Claims will generally be paid within 2 weeks of receipt. A suspended status means that the claim needs additional manual review by the fiscal agent. The claim will advance to paid status if subsequent reviews find that no additional information is needed. A denied status means that the claim needs additional manual review. A denied claim, either in the initial submission or after review, will be returned to you with the reason for denial. You may resubmit the claim after addressing issues, such as missing or incorrect information. Common reasons for denial include: the client is not enrolled in Health First Colorado. Check the system to make sure the member is enrolled in Health First Colorado and eligible to receive services prior to providing services. If the client is not enrolled in Health First Colorado, refer the client to the Colorado Peak system. Clients can also contact their county government agency, which may have trained enrollment specialists. There may also be missing or incorrect diagnosis or HCPCS codes. Make sure you use the correct combination of diagnosis and HCPCS codes. It is possible the member cap has been exceeded. All the benefits relate to the member. If more than one doula supports the member, then the combined time across those doulas cannot exceed the caps. For example, if one doula is reimbursed for one 60-minute visit and one 90-minute visit during the prenatal period, a second doula can only be reimbursed for one 30-minute visit or two 15-minute visits. It is also possible your claim does not align with an approved NPI. Make sure the NPI you include on the claim matches the NPI you use to enroll as a Health First Colorado provider. Finally, the claim may not have the NPI of the recommending licensed provider. You should have collected and stored the provider recommendation form when you first enrolled the client in doula services. If your claim is denied, you can make the needed corrections and resubmit the claim for payment. If you need help resubmitting your claim, you can contact the help number shown on the screen. Finally, we'll talk about provider maintenance and revalidation. It is essential that doulas keep the information in the Medicaid Provider Web Portal up to date through regular provider maintenance. In addition, doulas, like all Health First Colorado providers, need to revalidate every 5 years. Please regularly read email communications from the Health First Colorado and sign up for the MCH listserv to make sure that you stay current on all the latest information and requirements. In order to keep their information up to date with Health First Colorado, occasionally providers must submit provider maintenance requests. This information includes your specialty, address changes, and insurance updates. If applicable, doulas should log into the Medicaid Provider Web Portal and click Provider Maintenance to update their information. Detailed information about provider maintenance requests can be found on the Provider Web Portal Quick Guide on the department's website. Doulas will be expected to always maintain current doula training and CPR certificates, and you are responsible for uploading the required documentation to the Medicaid Provider Web Portal in accordance with the expiration dates of the relevant trainings. Since CPR certificates and doula training certificates have different expiration dates than the rest of the doula requirements, these must be updated through provider maintenance requests. Doulas will be expected to provide the department with updated information on business practices through the revalidation process, which occurs every 5 years. This process is important to ensure the information on file for each provider in the Medicaid Provider Web Portal remains current, including any needed certification and attestation forms. This information allows the department to properly screen providers to ensure that they remain eligible and for providers to continue to offer services to members. Ineligible and inactive providers will be removed during the revalidation process. Active providers that do not complete revalidation by the due date risk suspension of claims. You'll be expected to re-sign the attestation documents that were required in the initial application and always remain current doula certification documentation within the Medicaid Provider Web Portal, even between revalidations. There are several steps to take to make sure your revalidation runs smoothly. Keeping your email addresses current, submitting provider maintenance requests before revalidation, logging into the Medicaid Provider Web Portal, and applying for revalidation. We will dive deeper into each of these steps on the following slides. Doulas will receive an email 6 months before their revalidation deadline, informing them of the need to revalidate. They will receive monthly reminders after the initial email. Once you receive this initial email, access the Medicaid Provider Web Portal and supply the necessary information. Revalidation notices will be sent to the email addresses listed in the Medicaid Provider Web Portal. To avoid missing critical emails, keep an active and up-to-date email address in the Medicaid Provider Web Portal. If you work for a doula organization, consider using a generic email address to ensure that the given email address is not linked to a staff member who may leave the organization, and regularly check your email for messages regarding revalidation. Once you begin the revalidation application, you cannot submit provider maintenance requests. This means you cannot edit the pre-populated information, such as the business name, address, specialty, insurance information, and ownership during revalidation. To prevent this, log into the Medicaid Provider Web Portal and review the information saved in the portal before beginning the revalidation application. If you find incorrect or out-of-date information in the portal, submit the provider maintenance request before beginning the revalidation application. We've reached the end of this presentation. Thank you all for attending. If you have questions about the policies discussed during this presentation, contact the department using the contact information displayed on the screen. If you have questions about enrolling in Health First Colorado, contact the fiscal agent using the contact information displayed on the screen.